Hello, Baltimore. It's Dr. Jeff Kalkstein with Drs. Adolf and Kalkstein Chiropractic office in Towson. And I'm with Maria this evening. And I wanted to take the time. Maria's been coming to us for a while, and I'll let her tell you her story. But this is an important story to tell because of there's a lot of folks out there that probably have similar circumstances, right? So you look that way. There's the camera.
So I have had migraines for a very, very long time. It all started probably around when I was 20, and it got really bad right after I had children. And recently, I guess a couple years ago, they were coming almost every 2 weeks, and I was ending up having to go to patient first to get a shot to relieve the pain. And finally just stumbled upon this place, which is fantastic, and we've done a lot of things here. We adjusted my diet, and we did a lot of PT, and I guess Dr. Jeff can talk to you about the rest of what we've done.
The agitators, yes. So were your headaches daily?
It was like every other week. Mm-hmm. Yeah.
And were they disabling type headaches?
Absolutely. I couldn't be at work.
You couldn't work.
Mm-hmm. Yeah.
So I like to use a pain scale. 0 is no pain, 2, 3 is mild, 4, 5 is moderate, and this is all relative. 8, 9, 7, 8 starts to get moderate, severe, and 9, 10 to me is disabling. What would you say your headaches were like when you?
They were horrific. I mean, I couldn't do anything. I was bedridden for actually 3 days. Once it started, then I'd be in bed for 3 days.
So to me, that's disabling pain.
Yeah.
A lot of people come in with disabling pain, but they're still functioning to some level. But this is truly disabling pain. She couldn't function. She couldn't work, right? Yeah. So now, usually we do this in the very beginning when someone has great success, and we had some really nice success pretty early on, right?
Right.
So after about how many visits did you start to notice a change?
Probably it was within a month.
A month, yeah, that's right. Mm-hmm. So now we did an exam, and we used some pain questionnaires, and the treatment consisted of some dry needling, and you've all seen this dry needle. And we've had great results with headaches. We did some manipulation, and sometimes there's the standard manipulation. Sometimes we do that occipital lift for headaches, and we get great results, and that's what we started to do with you. Yeah. And then we started to introduce, we did some PT, some ultrasound, right? Mm-hmm. And then we started to add some exercises too. And like you said, we influenced her diet in a very positive way, and we turned her on to some resources, and she even turned me on to some resources that I wasn't aware of. So we're learning as we go through this, right? And now we're down to just periodic, aren't we?
Yeah. Once a week.
Once a week, and eventually what we're going to do is we're going to say, okay, live your life, and if you have any problems, come back and see us. And we're working that way because she's taken responsibility. She's doing all the right things at home, so it's been really, really, really nice. So what I wanted to show you is, tonight I'm going to show you the dry needling protocol we used, okay? But I wanted to set the stage to let them know what we were dealing with and the success we've had, right?
Yes, life-changing.
Yeah. Life-changing, yeah, that's great.
Yep,
that's great.
So
we'll stop right now. So I'm going to set her up into the dry needling position. You don't need to see all the prep work that's done to that, but I'll show you how I put a couple of needles in, and then I want to show them how we adjust you. Mm-hmm. We may or may not do that tonight.
Okay.
I'll show you how you adjust you because we're really active right now. And then even show maybe some of the resistive type exercises we're doing for some of the strength and the muscles in the neck. So we're going to pause right now. We'll come back and we'll do some dry needling. Maria's prepped and ready to go. And I just brought in a book to show you some of the muscles we're going to be working on. I call them the occipital triangle, right up the base of the skull. That would be the base of the skull. And these are some of the long muscles that run along the spine, okay? And after we do this, I've got a really nice anatomy book by Netter with illustrations, and maybe we'll put that on there because it's color, and it'll really be informative for you all, okay? So I'm just going to put a couple needles in to start with, okay? And so we've prepped the area, and we're going to come down to the occipital ridge, which is right along my thumb right here, and we're going to drop a needle into some of the occipital triangle muscles. So, did you feel that at all? Mm-hmm. And was it uncomfortable at all?
No.
But sometimes I get into a muscle, and do you feel like, oh my gosh, that's a good spot to be in or a bad spot to be in?
It usually feels good.
It feels good.
Twitch.
Yeah. You get a little
like
twitch
that,
response. Yeah. So what she's referring to when I actually get into the trigger point, so the purpose of the dry needling is to unlock tight muscles, and when we get into the sweet spot of the muscle will actually reflexly twitch, and the superficial muscles, you can see that happen, right? Some of the deeper ones, it's difficult to see, but I can tell you right now, the patients can feel it when it happens, and they can feel the relief after it happens. So I'm going to put 2 in on each side here, okay? And then I'm going to drop down just to show you, we were also putting some into our upper trapezius, and I like to use a pincer grip when I do that. And I'm just rolling the muscle underneath my fingertips, and you can feel that knot in there, right there, okay? So I'm going to just place the needle right into that knot, okay? And if she's a tough bird here. Do you remember the last time there you go. She's a small package, but she's a tough package. Can you feel that there? It goes right there.
Yeah.
See? I don't know if you caught that on motion right there, Jonathan, but that was great. I mean, I can feel it twitch in my hand. And that's the sweet spot. That's what I want to go after. The other muscle I like to go in for a lot of neck pain and headaches is the levator scapula, which runs along the transverse processes of the spine and attaches down to the superior medial part of the shoulder blade, and there it is right in there, right? And so I'm going to come underneath the trap and just find that muscle, because they kind of overlap, and they a lot of times get stuck together, right? So I'll put one in there, okay? And again, she's a tough bird. There you go. And there you go, right there. You okay with that? Yeah. So this was part of the protocol we used. We dry needled, and I put a few more needles in that, and I'll pick up on that. But I wanted you to see that, and then the next time we'll take a look at how we adjust her. So we're going to take a break now. There we go. Hello, Baltimore. It's Dr. Jeff Kalkstein with Maria again. This is the second part that I wanted you to see. Earlier we showed you dry needling, and we said we'd come back this week and show you how we were adjusting her, okay? So go ahead, Maria, just sit up nice and tall here for me. And I call this the occipital lift. Go ahead and turn your head to the left for me as far as you'll go, and then go back to the right for me, okay? Good, let's go back to the left a little bit, right? So I'm gonna come underneath like this, and you just put your head right in there for me. And so my contact is on the base of her occiput, and I'm actually going to get the occiput and C1 to move. So just relax your shoulders, right? And so just a simple input there, it goes right there. Beautiful. Good. Oh, good. Now come on back up here, Maria. We're going to go on your back.
Okay.
How'd that feel?
Awesome.
Yeah. So as I mentioned to you before, a lot of the headaches come from when C2 and C3 don't move very well. They irritate that suboccipital nerve, right? Mm-hmm. So the whole goal of the adjustment is to restore the motion segmentally. That is the relationship between how C2 and C3 moves, okay? And so what I'm looking for is the areas that are stuck. Beautiful, beautiful. And so any headaches this week?
Nope, great.
No, that's awesome, isn't it?
Yep.
And the sixth graders are happy too, right? Okay, so that's what we do. We did an evaluation that included a physical examination. We talked about what food she was eating. We talked about sleep, stress. We talked about exercise. So she gets adjusted, she gets dry needled. We showed her exercises to do at home, and it's made a positive impact.
Absolutely, absolutely.
Yeah.
I haven't had a headache in actually a really bad headache in months.
In months?
Yeah.
Uh-huh. And now, so we're tapering off right now. So we're down to once a week, and we're gonna start to do less as she needs less, and then we'll distance the time between her appointments and give her home therapies to do. And then if she for whatever reason she starts to feel a headache come on, she'll come back in, and you won't need an appointment. You could walk in the door, right?
That's the best part. If it starts to come on and then I come in, it just goes away.
It goes away.
Yeah. I don't
So,
need to take any more medicine anymore.
but you stop taking medicine,
Yeah.
and that's a huge benefit for you, right?
Oh my gosh.
Yeah. But you've earned it though. You've done everything we've asked you to do. You've kept your appointments. You've changed your diet. You have made lifestyle changes. and you do your home exercises. So
Yeah.
you've earned it. You know, it's a great result. Okay.
Thanks.
Thanks, Baltimore.